as you heard in the introduction, I focus, most of my work has been in healthcare and in online communities. And so I'm going to be telling stories that are related to the sharing in the healthcare sphere. But all of the practices that I'm going to discuss are completely transferable to other areas. So whether you're building a community for engineering students or coffee baristas, all of this will actually apply. So now that I heard about you, of course, I'm going to give you my story. We've already heard a little bit of it, but I'll go back in time. And we'll go back to 2007, and that's when I sort of took my first plunge into the online social networking space. And that was with a community called Sharing Strength Fort Ensemble, and that was a community for Canadian women with breast cancer. I have to say, you know, at that time, community management wasn't really even a term that was well known or used, and that most of what I did to build that community was guided largely by intuition. But I have to say that I'm really quite proud that after 4 years of being online, we had a really close-knit group of women who were sharing through their cancer journey, from diagnosis through treatment and post-treatment, and were extremely supportive of one another. And it was just pure serendipity that when our funding ran out for that community, the Canadian Cancer Society was taking the plunge and adding online support to their wide array of various support tools. And so they adopted our community. And that was a really successful adoption, and I was quite integral in that adoption in that I helped train their moderation team. They had already had telephone support. And there's, you know, similarities for sure, but significant differences to doing support online as well. And I was able to transfer some of the practices that I had learned over that 4-year journey with Sharing Strength. I then participated in the community to make sure that the adoption was successful. And there was a fantastic mutual benefit in that they had some ready-made members who already knew how to participate online and seeded the community, if you will. So it was a very successful relationship, and I think helped their community, definitely helped ours. And now I'm actually the community manager of Canadian Virtual Hospice, Portail Palliatif, another bilingual community. And our relationship with the Canadian Cancer Society continues as well, for people who may be interested in sharing about the end-of-life stage, dying, death, and through grief and loss. And so we help that transition as well if they want to focus more on that, although Canadian Virtual Hospice is disease agnostic, if you will, so it's not only cancer. The virtual hospice community is a relatively green community, or a new community. It's been up for just over a year now, and so I'll be pulling a lot of examples from that community. Of course, you've heard quite a bit about HCSMCA, and that's what I do in my free time, manage this community of over 6,000 people. And well, that's another story, but we'll talk about that. And I'm happy to say that I'm announcing here today for the first time that I'm going to be starting a new transition over at Princess Margaret Hospital, and will be the project manager of social innovation there. So I'm really, really excited about bringing all of that together. Thank you. That's enough. Okay, let's go on to actually how do we build online communities. So I'd just like to start with a quote that I think will bring us all together, whether we're working in the healthcare field or not. I'd like to read a quote from Susan Sontag. And she said, "Everyone who is born holds dual citizenship in the kingdom of the well and in the kingdom of the sick. Although we all prefer to use the good passport, sooner or later, each of us is obliged, at least for a spell, to identify ourselves with citizens of that other place." So what do we do when we're dropped into this kingdom of the sick? Well, we text, we call, we search, and we reach out to our networks. And this is something that we can now do online. The social web has enabled us to have access to people worldwide. And it's thanks to this social web that we can collect this knowledge of patients. And we can collect the user-generated content that now has value because the sum of our parts is much more valuable than any individual person. This is Owen. I'd like to introduce you to Owen. Owen, before he was born, his mummy thought that she could cure all little boo-boos and emotional ups and downs of her child through cookies and kisses. Well, as it turns out, just a couple of days after he was born, his mom knew something was wrong. And she knew that no amount of cookies and kisses was going to make this right. She found out, after much searching, that Owen had a very rare disease, a genetic disorder, and he is one of 7 million who have this disorder. So she mobilized everything that she could to help her son thrive. And she mobilized, she went to all sorts of healthcare consultations. She mobilized her personal networks. She did hours and hours of researching. But she is the first to tell you, here's Jen, this is Owen's mom. She's the first to tell you that it was because of the social web that she no longer felt isolated, that she got the support that she needed. Because, in between doctor's visits, we have a lot of living to do. And I love this quote from Kathy Kastner, and I'd like to attribute it to her. She's sitting here in the front in the blonde hair. So how do we help mobilize this social web? Well, I'm going to say that we need an enabler. This is another quote from Susanna Fox, who heads or is part of the Pew Internet Life Project. And their data shows that if you can enable an environment that in which people can share, they will. And the benefits will entice others to join. And I'd really like to focus on that word enable. Because if you remember back to that first title slide that was up there, you can have a lot of people congregate, like the birds on the telephone wire. But that's just a flock. What you really need is that old telephone operator who's making all the connections and making sure that people can get together and that they meet. Imagine if you were 1 in 7 million. It's really hard to find some other people just like you. So what exactly is an online community? Well, there's actually no universally accepted definition for this. But this is the definition that I think leads to success. It really comprises all the necessary components. First of all, it's a group of people who share a strong common interest. They form relationships and they interact online. Sounds pretty simple, right? Let's dive into these ingredients to success. So first of all, it's really, really important that you understand and establish your domain, that you build a sense of community, and that you develop a strategy according to the community's life cycle. So I'd like to go into, basically that's the summary of my presentation, so you can actually go back and drink right now if you want. I mean, if that means anything to you, feel free to go back and get a drink. I really, really won't be offended. If you want to actually get me one, but if you want to dive a little bit deeper, then hold on to your hats and stay in your seats. So the domain, that's the strong common interest. And it's really the domain that inspires people to participate. So not only to participate, but to contribute to the growth of the community. If you get that domain right, you're halfway there. And it's really important that you get that niche that you want to inspire people to participate on a topic that they want to talk about, not to sell a product, not to advance your mission and vision, but something that they want to talk about. In disease-related communities, I think the domain is fairly obvious. It's probably that disease state. So be it chronology.com for people who have Crohn's, be it the cancerconnection.ca for people who have cancer. could be Alzheimer's, any of these sort of unifying by disease, or it could be life stage. I mean, what is more popular than babycenter.ca? My goodness, new parents, oh, you want to mobilize people, guys, go for moms. Or virtual hospice, end of life, of course, another big stage where people really feel isolated. We're a social or a death-denying society, so it's really important to try and find others when you're faced with that situation. So most of those are communities of circumstance. There are many different types of communities. For example, HCSMCA is more of a community of practice. I would suggest that you're a community and that this is a community of practice. Sense of community. So this one I'll talk about a little bit now, but it's going to seep in throughout the presentation. But these are the 4 ingredients that are really going to deepen that sense of community to distinguish your community from a flock, right? It's that sense of belonging. It's that membership, feeling that you belong here. So that's that strong domain again. That identity or fulfillment of needs, so that the goals of the individuals of your community will match that of the community as a whole. That as the members satisfy their own needs, they're probably satisfying those of the community, and likely what you need them to satisfy as well. Their influence, I think this one for me is one of the easiest, but one of the most important, is to make sure that your community allows people to feel that they have influence and can be influenced. And it's nice to have needs will change as to whether you want to influence or to be influenced. So that's, I'm going to stop fighting with this microphone. And then the other one is attachment. So make sure that members, again, going back to that domain, if it's not what brings them first to the community, that they feel some sort of attachment, then it's what they will build together. And it's probably a little bit of both. So they come for one meaning. I saw this in the breast cancer community an awful lot. First of all, they just came, oh my God, I've just been diagnosed with breast cancer. What now, right? And I saw this kind of thing happen within minutes sometimes, that somebody else would then come with that cry of help. And that person who first had the cry for help became the mentor already, just because they were there a little bit before them. You're going to be okay. I'm okay. And it's really important that they will then feel that they believe they will share, or they are sharing a common place, history, or experience. This is the one that's going to take up the rest of the presentation. The community life cycle. This is the part that really defines all the activities that you would want to do with your community. So throughout the life cycle of the community, those things will be fine-tuned and will change as your community continues to grow. So just to read off what's obviously there is the inception, establishment, maturity, and mitosis. And you see off to the side there is death. And death doesn't really have an arrow because it can happen at any time. If you don't get things right, you can already experience death at inception. And so we really want to make sure that no arrow goes to death. And I'm going to say, if you follow some of these concepts and best practices that I hope to impart to you, that you can avoid that. Or you can just have the adoption. So inception. We'll look a little bit into inception, and I'm going to use some of the examples that I have from Canadian Virtual Hospice here. Inception really begins before you even have an online platform. So your community manager should be your connector already, working the room, if you will, drawing on their personal connections. If your community manager has knowledge in that sphere that you're wanting to build a community for, scanning social media to find out who's having conversations about this topic and where, and you're reaching out to them offline, the old-fashioned way, email, well, I guess that's not really offline, but you know what I mean, not on the platform that you're planning to build. Telephone, going to conferences and meetings where you would find those type of people that you want to have in your community. And I'm not talking about the influencers. You don't go to those keynote speakers. For heaven's sakes, they've got enough platform to talk about what they want to talk about. It's the underserved, it's the undervoiced, it's the people that don't have a place to go to talk. And you're doing a lot of micro interactions. You're probably refining your domain even. You might say that this was what you thought was going to be your common interest, and you might have to modulate it just a wee bit. And so help give them that ownership of what it's going to be. It's co-designed. They can also help to test the platform as you're rolling it out. Is the technology good? Are there barriers to participation? So that they already have that real sense of participation and ownership of that community. And they are then your core member. It's a lot of work. So don't fool yourself. It's a full-time job just to get those 50 first members. I'm not talking about registrants. I mean, you can do a huge marketing launch and have 1,000 registrants, but let's face it, if nobody's posting any messages, that means crap, right? You need to have activity. So you need that slow, organic growth. Oh God, I'm on camera and I just said crap. Oh, well. Anyway, you need that slow, organic growth, right? I mean, you need to build the community. You need to first start with your butcher shop, and then get the baker, and really to build that community one person at a time. But you need them to be active. I mean, think of how you feel when you walk into a room or walk into a house that's got a party. Where are you going to go? Kitchen, right? Who doesn't go to the kitchen? That's where the buzz is. It's not only because of the food, that's where the talking is happening. So you want to have some conversations already going on. So Virtual Hospice, I will tell you, has 100 members. 100 members. But if you clicked on this one forum, would you not feel comfortable going and talking on here? Look at the number of messages that you have on this thread here. You've got 100. You've got 50s, you've got 60s, you've got, 7s, 9s, not zeros, not one response, not two response. Are you really going to put in a question about, I'm scared my husband's dying, if there's a whole row of messages that only have 3 responses? Probably not. But this activity begets activity. So registrants do not beget participation. So you really want to focus on growing that membership, but getting that membership committed as well. This is just one really small quote of a million that I could have pulled from Virtual Hospice's community, a really, really tight-knit community. This says, in case you can't read the white on the picture, is this forum is like a big cozy blanket when I need someone to lean on. For me, that spells success. That's exactly what I wanted people to feel with this community. And it's really my core members that I got to establish that tone, that welcoming sense. Overwhelmingly, the testimonials that I could have pulled was, here's a place where I can speak my mind without judgment. So that just goes throughout the forums, that I can really say, sometimes caregiving 24/7 sucks. It's really hard. But I love my husband and I really want him to die peacefully. Or, I just lost my child and I don't know what to do. So people feel really, really safe coming and saying that on a public forum. Let's face it, this is public. They can speak anonymously, but it is a public forum. So let's move on to establishment, and I'll probably draw a little bit more from the Canadian Cancer Society's very successful online community, because this is the stage that they're more in. They're starting now, the community manager, Heather Sonardo, she's starting more that she doesn't have to do this sort of one-on-one interaction, or her moderation team doesn't have to do this one-on-one interaction. They can spread out to one-to-many type of announcements and letting more and more people know. So your activities start to shift, your outreach activities start to shift, and you're wanting to work on deepening that sense of community. So now you're taking those core members and you're seeing what they're good at. And if you see that somebody's really good at writing and have a fantastic knowledge in one particular area, give them a blog to write. You know, no longer just the forum discussions, but give them ownership over that area of expertise. You're wanting to build that collective knowledge and create content for and about the community. This is one example, not from the Canadian Cancer Society, but from Patients Like Me. How many of you heard about Patients Like Me? Very, very popular community website in the United States. And what they do is they assume that someone who, and I wouldn't completely agree with this, but it's one criteria, they assume people who post a lot of messages should be rewarded. And so you accumulate stars. And once you get up to 3 stars, because you've been very helpful, it's assumed that your posts are often very helpful, you can apply to become nominated as a mentor. And then in that disease area, you become a mentor to others. Other communities will have sort of a welcome party, if you will, and so there's special community members who are there just to sort of watch out for newbies and to make sure that they feel welcome and that they know where they can introduce themselves and be connected to someone else like them. This is of the things that you can also do is start to reach broader and to write about the community in third-party publications. And again, it's not a big launch. The launch in marketing, you got to put those ideas way out of your head. It just doesn't work for online community. It's word of mouth. It's really referrals bit by bit that you want to grow. And so here's eHospice is an international publication, and they did an article. I love the headline, Virtual Hospice's Online Community is Virtually Indispensable. And of course, then as a community manager, I bring that back to the community. It's like, hey, folks, people are writing about you. You're making a much bigger impact than just your little group here. The Canadian Cancer Society had a great write-up in the Toronto Star that A Click Away from Comfort was a beautiful article. And this is 5 Million is a community, again, a U.S. community called Inspire. And they reached over 5 million messages and just wrote that in their internal blog. So not an external publication whatsoever. It's just like, you guys are producing a lot of great information. Way to go. Doesn't take much, but thank yous go a long way. So then I come into the maturity. And maturity is a place that online communities can stay for a long time. Here you're really focusing on scaling the community. So some of those duties that you're seeing or those special areas that members are showing aptitude for, you want to give them more and more responsibility for those areas, really to try and make it as an acknowledgeable duty, if you will. As I already mentioned, somebody who writes a blog, but maybe you want to venture into in-person meetups, and you have somebody who would plan a meetup not unlike what we're doing today. I've found that Healthcare Social Media Canada was just a Twitter chat, for heaven's sakes, and it really deepened our community tenfold when we started to have regular meetups as well, and we've done them across the country, which is really quite exciting to bring people together with such power as that. And so this is another time that you might want to look into expanding your technology. So if you only got discussion forums, you want to maybe add blogs and chat rooms and have experts come on and talk, or have members invite experts that they have connections to. You're really wanting to co-create as well. I mean, this is an incredible treasure trove of collective knowledge. So why not be the experts in the field, whatever your field may be? And have them, first of all, maybe write a community charter together. It's a very bonding exercise that people can do. Or you might, in the case of Healthcare Social Media Canada, perhaps we're going to... I'm just kind of winging it here. What the heck are we going to do? An innovation fund, and we're going to start to build an innovation fund that will help then send people to international conferences with a social media bent in healthcare. How about that? I'm kind of liking that. So What did I put? Oh, hey, I'm talking about myself. I forgot what I'd put for an example here. So this is just to reiterate what Diane already said at the beginning. So I'm really quite proud of Healthcare Social Media Canada. It just started out as an idea over 2.5 years ago, September 2010. And as you can see, just to throw some big fancy numbers at you, we've already had up to almost 7,000 people participating. And that has evolved through 129 chats. And we've also had, I think about 15 meetups in that time across the country. So if you're interested in partaking in some of these chats, it's on Wednesdays at 1 p.m., except for the last Wednesday of the month. We have them in the evening so that doctors can take part. They tend to. So we really have everybody from all healthcare sectors taking part, but the surgeons seem to like the evening ones. So I was talking about co-creation, and really everything that pushes HCSMCA forward is done by members, because I'm doing this in my free time, so I really don't have time to do much more than to manage the tweet chats. And so people are organizing these events. Other people moderate the chats. We've had over 40 people moderate the chats over the 2.5 years. So it's not the Colleen Young show, I'm not really interested in that. I'm wanting more of the sharing. And this is just a little cutout from one of the infographics. We have somebody who makes infographics as our report card every 6 months. It's a lovely thing, and I've just it's really long, so I just took out this excerpt. But I'm really, really encouraged by how much the members themselves are engaged in healthcare social media. Mitosis. So I find this one really quite important in that a lot of times people think bigger is better. You just want more people in your community, but it's not. So you really have to understand where the breaking point or where that sort of sweet spot is for your community. And recognize that, because if it gets too big, you will undermine that really important sense of community. You want to make sure that people can still find people, right? And that people still feel that they can have influence, and that they are influenced, and that their voice can still be heard. So if you see that start to happen, it can spiral to the deaths the cycle really, really quickly. But you can avoid that by watching what happens, and maybe make a specialty group, a sub community out of your main community. So that's what happened with HCSMCA. We are getting quite large now. And out in Vancouver, they started something called evening rounds. So people still participate in the HCSMCA Twitter chats, but they have this monthly in-person meetup. And they've made a model that can be adopted by any city in the country, and are really quite willing to share. So they've maintained the spirit of HCSMCA, given it a slightly different name, but still use the vehicle of HCSMCA to advertise about their meetups, and are willing to share. So I'm completely happy with that. And it wasn't even my doing. The community did that themselves. So for me, success. Well, and you do have to measure for success. And I think most of the people in the room will realize that this isn't just spaghetti you throw against the wall and hope that it sticks. You really have to measure for success. And there's a number of different things that you can measure. But you have to remember, as a community manager, you have to measure that you can maintain. So there's a ton of things that I could measure, but what is really going to advance my community? And so you're wanting to measure growth, activity, and sense of community. So growth, of course, is the membership, but it's not just registrants. You want to know, what is your conversion rate from registrants to active members, right? Because registrants means nothing, right? And so that can tell you something. If you're seeing a lot of people registering but not taking part, what's stopping them from taking part? So is it technology? Are you asking them to fill out a profile that, my God, even Census Canada doesn't ask? That would stop me from participating. Let's make that really easy and say, get them to fill out their profile after they've posted their first message. That works, right? Because that can be then another measurement of success. They felt some sort of belonging to the community that they felt they needed to tell the community about themselves. They went back and filled out their profile. It's also a fantastic connection point for the community manager. Say, hey, I've seen you've been posting. I love your comments. Tell us a little bit about you. Whoa, that's fantastic. Then you also want to measure activity. So who's posting a lot, who's posting where? You want to find your ambassadors. You want to find those core members. You want to find the expertise within your community. Give them that leadership role. I see that you're really helpful in this area to people. You really mentor. Perhaps you'd like to start a blog in that area. Or I see that somebody's floundering over here. Can you give them a helping hand? So you're doing a lot of hostess with the mostess in the background for your community to be successful. You want to measure number of posts in the past month, number of posts per member, so that you can see if you're starting to go towards that death spiral. The death spiral shows itself really, really early on, and you can nip it in the bud before it becomes apparent to anyone. And so you're going to want to do whatever you need to measure to show growth and to improve the platform, of course, to improve your community, but also to report value. So many times I've heard of communities folding because the stakeholders, the funders, didn't see the value. And there's just no excuse for that. And it's up to the community manager to be able to relate that value. So find something that's going to, in a nugget, in a number, in a graph, in a pie chart, show your stakeholders why they need to keep investing in this. And it's probably a little bit of a combination of something that you can capture at a glance. Some graph that goes up is always good, but a little bit of those testimonials like the Cozy Blanket testimonial. And so to get that sense of community measurement, you're probably going to have to resort more to something like surveys. A little bit of a sort of a double-edged sword on the survey, because you're probably going to get the most engaged community members to answer that survey. How do you get some of the answers from the people who don't participate in your community? So that's an ongoing challenge. How many times can you survey your community? But that shouldn't be a reason not to do it. So you need to get some of that data as well. So qualitative and quantitative data. So what is community management? Well, it's a heck of a lot more than moderation. It's really not just watching the conversations going on and just tut-tutting people who aren't staying within the rules. It's a lot of playing hostess, making sure people have a lot of activity in the kitchen, and when it's time for them to move into another room, make sure that that conversation happens in the other room as well. So I'm going to say thank you at this point. And this is, just in case I forgot my name, this is the slide that I put up here because, it's not that I'm narcissistic or anything, but I would really, really welcome your questions. Oh, we're back.